Mr. Tan Tee Hau, Chairman of NHG, Professor Eugene So, CEO, Tan Tock Seng Hospital and NHG, Professor Chin Jin Ji, Chairman of the Medical Board. Jin Ji, where are you? Distinguished guests, ladies and gentlemen, good morning to everybody. I'm very happy to join all of you today for the official opening of the Ang Mo Kio Specialist Center. This is the old site of the Ang Mo Kio Polyclinic, built 40 years ago in 1981. The polyclinic was upgraded 2 decades later. In 2004, I opened the upgraded facilities here. And later, in 2018, we replaced it with an expanded polyclinics a few blocks down the road. This building was then redeveloped as the new Ang Mo Kio Specialist Center, and we are all here today for its official launch. These developments, the upgrading of the Ang Mo Kio Polyclinic and the opening of the Ang Mo Kio Specialist Center, reflect the continuous improvements to Singapore's healthcare system over many years. Improvements which better serve our population and which take a more person-centric approach towards healthcare. We're empowering individuals to care for their own health through preventive health measures. We're anchoring disease management within the primary and community care settings. And we are networking together agencies and community partners to coordinate healthcare and social support. The new Specialist Center brings a suite of specialist healthcare facilities and services right to the doorsteps of the residents, as you heard from Professor So just now. Until recently, an elderly resident in Ang Mo Kio who has blurred vision would have been referred to Tan Tock Seng Hospital for testing, consultation, treatment, and follow-up. But with this new center, he can now obtain medical treatment, cataract surgery, and post-surgery reviews right in his neighborhood. And similarly, for patients who need colonoscopy or gastroscopy procedures, or musculoskeletal rehabilitation, just to name a few. In making specialist medical treatment more accessible for residents, this specialist center seeks to provide a more seamless healthcare experience. Its one-stop transdisciplinary diabetes clinic is a good example. Here, instead of having multiple medical appointments, residents only need to see one allied health professional who's cross-trained to provide interdisciplinary diabetes education and medical care. And support services like medicine delivery will also be here, reducing hassle. This will offer patients continuity of care. Throughout their course of treatment, the staff at the clinic will work closely with the primary healthcare providers, the GPs and the family physicians. We'll keep them updated of the test results and the progress of the patient, and will enable the GPs and the family physicians to follow up with the patients. But good health depends on more than access to the best medical treatment. Social factors too have a big impact. And that's why the center has invested in community health teams and worked closely with other agencies and community partners to look after the well-being of patients. Patients like Mr. So, who moved to Ang Mo Kio recently and was referred to the center. And during the community health team's first home visit, Mr. So shared about his medical conditions, as well as his anxieties, living in a new community with little family support. So the health team got to work. They helped to coordinate his treatments and enrollment to a senior daycare center. They also brought in the Ang Mo Kio FSC's Mind Care staff and Touch home care nurses who visit him regularly at home to provide nursing and medical support. And they also brought in the Silver Generation Office staff and volunteers who visit him to assist with ad hoc tasks like housekeeping and groceries. Mr. So is now adjusting to a care routine that he's comfortable with, and slowly but steadily, his condition is improving. Another crucial aspect of health is preventive care. The saying goes, an apple a day keeps the doctor away. we try to do a bit more. And that's why the Centre and its partners offer community wellness programs to residents and provide health coaching to help residents work towards personalized health and lifestyle goals. The community health teams have also built and trained a network of peer support leaders. They raise awareness about health and wellness in their neighborhoods and communities. The PSL's peer support leaders launch programs like group exercises to encourage fellow seniors to stay active, and guided cooking sessions to promote healthier eating. Ultimately, ensuring the health and well-being of our residents takes a collective effort. The government continually reviews our overall healthcare strategy and policies, builds new and better facilities, and staffs them with well-trained professionals. And the healthcare providers constantly work on improving the level of care provided to residents. But residents too, you must play your part to keep yourself healthy. Mr. Ong Ye Kung, the Minister for Health, shared some statistics in Parliament recently during the Committee of Supply. The figures are quite worrying. Between 2017 and 2020, that's up to the beginning of COVID, the proportion of Singaporeans with high blood pressure increased from about 2 in 10 to 3 in 10. With high cholesterol from 3 in 10 to 4 in 10. And obesity rates also went up from under 9% to over 10%. The diabetes rate stayed the same, but that was only after we declared a war on diabetes in 2016 and made concerted efforts to tackle the problem. And even then, we only managed in barely holding the line. So unless we make progress on these, and we don't look after ourselves, and we become overweight and obese, and our blood pressure goes up, and our blood sugar goes up, and our blood cholesterol goes up. Chinese say, 三高, 3 highs. Then all the most expensive and advanced medical care in the world will not succeed in giving us more years of healthy life among our population. So all of us must make the effort. Go for regular health screenings, follow the advice of the medical professionals, stay active, keep fit, watch what we eat. I know there's good food just around the corner, but please, not too much, everything in moderation. And that's how, even with an aging population, we can help our healthcare system to ensure sustainable and good healthcare for all Singaporeans. So I congratulate NHG, TTSH, and all your partner organizations on today's official opening of Ang Mo Kio Specialist Centre. Thank you for your continued contributions and your commitment to delivering better health outcomes and more positive experiences to our residents and to improving the healthcare system in Singapore. Thank you very much.